you're here to get a better understanding of the material, okay? If you are not a nurse, that don't mean you don't come in here and listen. You come in and get some advice on healthy living, okay? We ain't perfect. I keep digging in the cake bowl, okay? I'm not coming in here acting like I'm just the perfect, healthiest person on the planet. I promise you I'm not, okay? I just had a whole bunch of chicken. Look, the sick, talking to the sick, you know? Hey, anything we can do to promote health, you know, with human civilization. Let's get it. So we're talking on Cushing's syndrome and Cushing's disease. You have to know that there's different ones, okay? So let's talk about Cushing's syndrome. This will be in both disorders. It's going to be a high cortisol level. Okay, I'm about to dig deep. Okay, so with the increased cortisol level in Cushing's syndrome, why is it happening? Your adrenal gland, which is responsible for releasing cortisol, it's hyperfunctioning. I mean, it's doing its work too much. Okay,
there's a tumor that's causing the increased cortisol levels.
This is how you tell if it's different from the syndrome or the disease. Okay, with the disease, there's something happening. There's a tumor on your pituitary gland. Okay, we'll dive into that, but right now we're going to talk about the Cushing's syndrome. So let's talk about the pathways into which cortisol is made. In your hypothalamus releases CRH, which is cortisol releasing hormone, okay? That goes to the anterior pituitary gland to release ACTH, adrenocorticotropic hormone. Hold on, I need to see what that T there. Wait, hold on, I need to see what that T there. Wait, ACT. Cortisol releasing hormone, or CRH. That's going to travel to the pituitary gland. The anterior, the front of it, to stimulate the release of ACTH, adrenocorticotropic hormone. That's going to go into the bloodstream and travel to the kidneys to act on your adrenal glands. Once on the adrenal glands, it's going to turn that or trigger the adrenal glands to make cortisol. Cortisol is your stress hormone. When I say stress, yes, stress from, you know, you lost your keys, or, you know, you're going to work and stressed out, but that's not really the stress that really is being talked about here. It's let's say you got a disease or something that's putting havoc on the body. It's causing for your cells to do more work. That type of stress. If you're at home and you worried about if you're gonna die tomorrow, okay, that's the type of stress. You know, but I really don't talk about that kind of stress. I'm talking about the stress that y'all not looking at. If you're pregnant, that can be a stress on the body. It can. You know, you're feeding two people, and you got to control those hormones. If you got hit by a car, that pain that stems from that wound that you got, that's a type of stress on the body, okay? And when you're undergoing that, cortisol is released so that your body can handle it, basically. But there are some things that can go wrong if your body is releasing too much of that stress hormone, okay? And we're going to dive into it, okay? So we got the pathway. We talk about the difference between Cushing's syndrome and Cushing's disease. However, we're still going to talk about the Cushing's disease. We're still on syndrome. So let's talk about what cortisol does. Hold on, I want to have my paper here so that, there it is here. It does a lot, y'all. It really does. So you see people with Cushing's syndrome, they have a buffalo hump, okay? The big hump on their back, their extremities will be real skinny, but their trunk area will be more heavyweight, okay? Let's talk about why that is. Cortisol raises your sugar level. How? Through glucogenesis. Hold on, I want to make sure I'm saying the right kind, okay? I ain't scared to flip back to my notes. However, I think I left all right. So your cortisol is responsible too for initiating gluconeogenesis. That's where the body takes non-carbohydrates to make a substitute of sugar. Okay, what element? I mean, what substances, what proteins is the body taken from in order to make this sugar? It's taken from the bones. So when you see in Cushing's disease, people have a lot of bone fractures out of nowhere. They have osteoporosis because that high cortisol is needing that glucose made so that it can support you in your stress levels. They're gonna break down your bones, break down your muscles in order to make glucose. And even if you eat, it's still gonna do it because it's high cortisol up in your body. Okay, that's why you don't want to be stressed out all the time because it really affects your health real bad. So again, this process is called gluconeogenesis, where the body is taking your amino acids from your muscles, the proteins from your bones. Okay, it's taking up the fat to make glucose, and when it rips out the fat, it makes it to where the body redistributes the fat. At first, you have big fat arms and stuff like this, to where I said like this and I will go like this. You know, anywho, you used to have real big arms, but with your high cortisol levels, it's going to redistribute that fat to your back, to have a buffalo hump, your big stomach. Okay, and in the process of that doing it, because it's stretching that skin to all that fat accumulating, I'm telling you, your extremities are going to be real skinny, but your trunk going to be real big, because that process of breaking down fat to turn into sugar, your body's able to move that fat around in Cushing's syndrome. Okay. It's breaking down fat to turn it into sugar. It's breaking down your muscle proteins to get sugar. It's breaking down, I already said, your bones. You might say, I want Cushing's. No, you do not. Okay. What else is happening here? Why else is having high cortisol levels so bad? Because it decreases the immune system. Okay. It's going to stop your white blood cells, really. It's going to stop them from releasing cytokines or histamines to alert the body that there's bacteria around. And so if your white blood cells are not able to do this, how's your body going to defend itself from bacteria? You're going to get sick often. When you're stressed out, notice if you're taking about to take an exam or whatever, and you notice people start to get sick around the exam because you're stressing out. When you're stressed, your immune system is down. Just know that. Okay. What else is cortisol responsible for? What does it do? It helps men with testosterone. I'm saying this because with women who have increased cortisol levels, they start to have a beard. like they can do like a man. You know what I'm saying? They have increased armpit hair. Okay. What is cortisol also doing? It's trying to increase your blood pressure. I know. Just hear me out as I give you this podcast here. Okay. So we talked about cortisol initiating gluconeogenesis. It also initiates glycogenesis, where the glycogen stores in your liver, it helps activate your body's ability to break down those glycogen stores and turn it into glucose for energy. You have excessive amounts of cortisol in your body, you're going to rapidly be utilizing your sugar to the point to where the body is going to be making it from your bones, your muscles, your fat constantly. That's why you need to get treatment, because it will do this till you die from it. Okay. I know it sounds like it's a good jolly, what a good jolly. It sounds like that, but this is very serious. Okay, people dying almost on a daily from these diseases here. Okay, or this one's on a daily from these diseases here. Okay, or disorders. Okay, so we talked about the stretch marks. Why the skin stretches, the striae on the abdomen with Cushing's syndrome. What appearance changes will help you distinguish if it's Cushing's syndrome or Cushing's disease? In Cushing's disease, you have pigmentation problems, skin pigmentation problems. You have those little liver-like spots on your lips and things like that. Okay, and there's another thing. You'll be hairy. If you're hairy and you have the pigmentation changes, this lets you know that you have the Cushing's disease. In Cushing's syndrome, you'll have the fat deposits, the buffalo hump, okay, the striae on the stomach, the real, and this is pretty much in both of them, okay. But to help you understand it, which one's the disease, is they have the hairiness and the skin color change. You have the disease part with yours, okay. But in both, you're gonna have the buffalo hump, the striae, the porous bones, because the body is eating at the bones to put sugar in the bloodstream. It's turning that broke down bone that is breaking down into sugar. So you'll have this can lead to bone fractures. This can lead to bone fractures, frequent bone fractures, okay, out of nowhere. Especially, when you're on your legs, it carries a lot of your weight, and your body's breaking down the bone. Your body's breaking down the bones for glucose. You're gonna have high sugar levels in this disorder. Yeah. So watch that sugar. You're gonna be thirsty. You're gonna be peeing to get that high sugar level out. You see how all these diseases are. So what happens if let's say let me if I have a tumor on my pituitary gland that's acting like my pituitary and it's causing an increase in ACTH, that if ACTH is around, it's going to get turned into cortisol. ACTH is around, it's going to get turned into cortisol, and that's going to up my cortisol levels. You can have a tumor on your pituitary gland that will be producing ACTH on its own.
A great difference between Cushing's syndrome and Cushing's disease is that in the disease, you have a tumor on your pituitary gland that's acting like it's the pituitary gland itself, okay? And it's releasing high amounts of ACTH, which is getting turned into cortisol. With the feedback loop, if there is an increase in cortisol, the body is going to make a decrease. It's going to turn off the production of ACTH. Therefore, this would decrease the cortisol levels. However, this tumor is producing large amounts of ACTH on its own without the hypothalamus, because it's a tumor, okay? So if they give you CRH, because the pathway to get cortisol is CRH, which is the cortisol releasing hormone, that gets stimulated into ACTH, and ACTH goes to the adrenal glands to get turned into cortisol, okay? If they give you CRH and there's a decrease in your cortisol levels, as well as a decrease in ACTH levels, this is how they know it's a pituitary gland tumor that you have Cushing's disease. Another distinguishment between if you have Cushing syndrome or disease, that in the disease, there could be a tumor somewhere else other than on the pituitary gland that's causing an increase in ACTH and increasing cortisol levels. And that is like a small cell carcinoma in the lungs, where it'll produce high amounts of ACTH, which will get turned into cortisol. So if they give you CRH here and things stay the same, this is how they know that it's a tumor somewhere else and not on the pituitary gland, because the pituitary tumor on the pituitary gland is acting like it's the pituitary gland itself. So whenever it sees CRH, it's going to turn that into ACTH, which is going to increase the cortisol levels. Try not to make it confusing.
Cortisol. What does cortisol do on the body? It increases the blood pressure by means or how? It binds the receptors on the adrenal glands to produce aldosterone. Aldosterone
Hold on to your sodium, but it's depletes your body of potassium. It wastes potassium. So with sodium, it's going to draw water to it. It acts like a magnet to water. So if you got sodium around, you have water, and that's how the body uses aldosterone to up your blood pressure. Again, the production of cortisol starts in the hypothalamus. The hypothalamus releases CRH, or corticotrophic releasing hormone, that travels to the anterior portion of the pituitary gland, which stimulates the release of ACTH, adrenocorticotropic hormone. This is going to go into the blood all the way until it travels to the adrenal glands, and when it reaches the adrenal glands, it's going to get turned into cortisol.
Here we go. In the liver,
Cortisol.
it's going to initiate gluconeogenesis. That's where the body's going to take from your bones or your muscles and your fat and turn that into glucose, which is going to increase your sugar levels. Okay? So just think about you being stressed out. You're hyper, you're alert, you're in your fight or flight type of feeling. Okay, that takes energy, that takes sugar for you to be able to do that. And what is controlling that? Your cortisol levels. So do you see why this would have you to use a lot of sugar for energy? You'd be pumped up, you're ready to, you might not feel like doing it, but you're ready for it when you're stressed out. You know what I'm saying? So if you have Cushing's disease or syndrome, you have high amounts of cortisol circulating. Y'all, this is bad. Okay, all this sugar floating around. And also in the liver, to add to that, your high sugar levels, glycogen stores are going to be getting utilized here. Okay, so you see how you're going to further elevate your sugar levels. Let's talk about, okay, what happens when the body takes from the muscles and the bones and the fat to make glucose. Because even though you eat, you'll still be adding to your sugar levels. Okay, let's talk about lipolysis. Yes, glycerol. Yes, glycerol is a head part of the fat, triglyceride. Okay, and you add it post tissue. Okay, it's gonna get broke down. And with that sugar, with that fat being broke down and turned to sugar, the other part of that fat is still loose. So what do you think the body gonna do with it? It's not gonna put it back. It's gonna put it on your back. So when you see people with Cushing's disease or syndrome, they have a buffalo hump. Their body is gonna take from the fat from their extremities and put it and redeposit it to their trunk. Okay, they have real skinny arms, real skinny legs, but their trunk be real, they be big right there. They have a moon face, real smooth face, because that fat is being deposited in their cheeks. Okay, so while your body is breaking down the fat to turn it into glucose, the other part of the fat is putting it somewhere else instead of where it got it from.
Let's talk about what cortisol does to proteins.
Everything in you is a protein to a degree. Your bones are made of proteins. And with your body, if you got high cortisol levels, your body is sucking up anything like a vacuum to turn it into glucose. So it's looking at your bones like, there's something I can turn into glucose, and it's sucking. Okay, so you'll see why you would have osteoporosis if you have Cushing's disease or Cushing's syndrome. Your body's taking it to make glucose, your bones. You have bone fractures here, you be really weak, you know what I'm saying? Oh, it's bad. Now, that same effect is going on to your muscles. The cortisol is got a vacuum, and when I do my canvas on him, I'm gonna have a Luigi with his a vacuum, like suck it up. And when I do the canvas, it's gonna be real tight, oh, look at these ideas, okay? So cortisol is looking at your muscles and saying, I turn into sugar. And that's why you'll be real skinny. You really don't have you really have skin in Cushing's disease or syndrome. Real skinny, but your trunk is big. Now, with the body, I'm going back to the fat here for a second to talk about the stretch marks that you would have in Cushing's disease or Cushing's syndrome. Because the body is redepositing that fat that it used to turn to sugar, the other part of that fat is being put otherwhere else on your body, like your back, trunk, stomach, you know what I'm saying? Your face, your moon face area here. The striae, it's doing that. Do you see how the redistributing the fat to your trunk will make your skin stretch? And so it will have these stretch marks called striae. It's rapidly doing that. It's growing fast, the fat, okay? All right. So we talked about glycogen. With high cortisol levels, acts on the liver to cause the liver to use the glycogen stores. Your glycogen stores is what your liver and your muscle cells use in case they run out of sugar from in the blood. Okay, they tap into their storage house, use it. Okay, but that can't happen without cortisol. And if it's elevated so high or really elevated, you can only imagine what's happening. It's using up those glycogen stores. And so what happens when those storages are emptied? It goes to the fat. Now what happens when the fat is used? It starts eating itself. The body will eat itself, turn the muscles into amino acids back. Catabolism. It'll break your muscles down into amino acids because amino acids are the building blocks of proteins. Your muscle is a protein. And we just talked about how the body's going to, like a vacuum, suck up anything that can suck up to turn into glucose. So after the glycogen stores are used, and they say ain't no more fat, to a degree, they use the muscles. And so you see these people real skinny with no muscles on their arms. Let's talk about the effect of cortisol on your immune system. You're constantly stressed out. Okay, cortisol is going to go on these, on these white blood cells and inhibit them. They're going to impair them from being able to release histamine or cytokines to attack bacteria or to alert the body that bacteria is around. And so if your cortisol is preventing your body from being able to alert itself that there's a pathogen, what do you think is going to happen? That pathogen or bacteria is going to multiply and cause you to get sick. So this is why you see people taking corticosteroids, which is cortisol. This is why they have they have to watch for being sick. The main sickness that they experience to a degree is thrush, fungus type of infections, fungal infections, canthonitis. Okay, thrush. Cortisol also helps to elevate your blood pressure. How does it do that? Well, it's going to cause for ACTRH to act on the adrenal glands to produce aldosterone. Aldosterone is going to hold on to sodium and get rid of potassium, and that salt or sodium likes to attract water. So if you're holding on to your sodium because aldosterone is here and you let go of your potassium, you see how this would increase your blood pressure because water is going to attract to that sodium like a magnet. So let's say sodium's in your bloodstream and it go by, let's say it go here. Whatever water in this limb here, your vessel is going to suck it into the blood vessels so that your blood pressure can be raised. So you want to watch out for low potassium levels with patients dealing with this disease here. Because it leads to heart problems. Yeah. What else does cortisol do? It helps with making hair. If you have too much, like some women that want to be dykes, they go take some medication to make them have beards. Those medicines are acting on their cortisol. Okay, but without medicine alone, okay, cortisol is going to make you hairy. It's going to increase your libido with sex. Okay, it's going to he's so healthy, y'all. It's going to help with testosterone production in men and estrogen in women. Okay, for us women, it's going to help your breasts. It's going to help make your hairs and your pizza on your pizza. Okay. Gonna make your hair on your arms. Support that, y'all. Let's see what else we gotta talk about. So we go to your gonads, sex glands. I don't want to make a big deal on the sex gland with cortisol, but it will decrease your ability to have sex. It will do that. Erectile dysfunction and things like that. You want to watch out for white blood cell elevation, even though cortisol is going to decrease your immune response because it prevents those white blood cells from being able to go into the interstitial fluid where the bacteria may be residing. Because cortisol constricts the vessel, it makes it tight, so things are not going to be able to easily slip through them like your normal white blood cells or macrophages to get rid of bacteria. So you have an elevation of your white blood cells, but it's because they can't get ready to go. Just know that too, okay? So if your cortisol levels are really high, you're at risk for infections, okay? Now let's talk about how you distinguish Cushing's syndrome with Cushing's disease. How do you differentiate those two? Well, in Cushing's syndrome, you have a overstimulated adrenal gland, a hyperfunctioning adrenal gland that's producing cortisol. Or you have medications that you're taking that's increasing your cortisol levels, like steroid medications. Okay, corticosteroids. Any of the meds got zone in it. Let's look at some steroid medication. Steroid medication. So just think about those wrestlers who be taking steroids. They are not faking. They are really that's really how they acting. So when you have people with cortisol like that, you need to watch for they'll be highly irritable. Okay, and they're psychosis. They can have a psychosis there. So you need look, we talking about the bedrooms. Just imagine them coming in. All ready to make some. They really mean that shit. Okay, I'm just saying. Steroid medication. Hell, they did not give me none. Methylprednisone. That's where I'm gonna get. We got prednisone. Okay, we shot the target. Okay. Now, we already said that if it's the syndrome, you either have an overfunctioning, hyperfunctioning adrenal gland that's releasing your cortisol, or you have medication that you're taking that's causing an increase in cortisol. In Cushing's disease, you have a tumor on your pituitary gland that's releasing ACTH that's going to get turned into cortisol once it travels to the adrenal glands to get the transforming done. Okay. Or in Cushing's disease, you have a tumor somewhere in the body. The main place you will find it, even though it can be anywhere, are in the lungs. Your small cell carcinoma within the lungs. Okay, that will be producing ACTH. If ACTH is present anywhere in the body, it's going to get turned. If it's present anywhere in the body, it's going to get turned into cortisol. So if you have a tumor in your lungs that's producing it, okay, you don't need hypothalamus to release CRH where it gets turned into ACTH in the pituitary. This tumor on its own is going to be producing ACTH. So when it comes to diagnosing if you have the syndrome or the disease, let's talk about it. Okay, right here. I'm gonna get straight to it. So they're gonna obtain a urinary obtain a 24-hour urinary cortisol to see if. So we're trying to see if I have Cushing's syndrome or Cushing's disease. What's going to happen? Okay, you're gonna obtain an ACTH.
In Cushing's syndrome, there's going to be a decrease in ACTH.
Why is it going to be a decrease in ACTH?
In Cushing's syndrome, there's going to be a decrease in ACTH because the adrenal gland itself is producing cortisol on its own. It's hyperfunctioning. It has nothing to do with your pituitary gland producing ACTH. It don't need ACTH. It's going to produce cortisol. So you will have a decrease in ACTH, but an increase in cortisol in Cushing's syndrome. The pathway to creating cortisol starts in the hypothalamus. CRH is released to stimulate the pituitary to release ACTH. ACTH goes into the adrenal glands to create cortisol. In Cushing's syndrome, there's no need for them to use ACTH because the tumor on the adrenal glands is producing cortisol. Because the tumor on the adrenal gland is producing the high amounts of cortisol.
Your pituitary gland is it's not secreting the ACTH for your cortisol levels to be elevated. You have a hyperactive adrenal gland. And so to treat that, if you're taking steroid medications that could be the cause of why your cortisol levels are elevated, you're going to tamper down on those steroids. If it's just your adrenal gland on its own that's doing that, they can give you a medication called, it's KETOCONAZOTE. No, it's an L. Ketoconazole. I tried. I know. And this is going to suppress the adrenal gland so that it won't secrete cortisol. And other measures is to have surgery, adrenalectomy, to remove the adrenal gland because it itself is making you might want to think about it because if your cortisol levels are so high, you're sucking all of your bone amino acids, your muscle amino acids to make sugar, your fat, you know what I'm saying? You have high blood sugar, this can kill you. You'll think about going ahead and have that surgery, okay? We talked about how you know you have Cushing's syndrome is if you have a hyperactive adrenal gland that's constantly producing cortisol, regardless of ACTH. ACTH ain't even being released by the pituitary gland, and you still having these high cortisol levels, okay? Or you're taking medicines that is increasing your cortisol levels like corticosteroids, your steroid meds. That is how you distinguish if that is Cushing's syndrome or Cushing's disease, because in Cushing's disease, there is a tumor on your pituitary gland or there is a tumor somewhere else in the body, like your lungs, that's secreting ACTH that's getting turned into cortisol. It's a tumor doing it.
Again, the way you distinguish if you have Cushing's syndrome is that you will have elevated cortisol levels, but a decrease in your ACTH because there's a tumor on your adrenal gland that's producing the high amounts of cortisol. And also, if a patient is taking steroid medications, that could be increasing their steroid levels because that medication is going to be seen as cortisol in the body. With Cushing's disease, there is a tumor on your pituitary gland that's producing high amounts of ACTH. And when the doctors pull them in to do lab testings on those levels, they'll have an increase in their ACTH as well as an increase in their cortisol levels. So again, in Cushing's syndrome, there's going to be a decrease in ACTH production, but an increase in cortisol. And in Cushing's disease, there's going to be an increase in ACTH production as well as an increase in cortisol because anytime ACTH is around, it's going to get turned into cortisol. So do you see how in Cushing's disease, both will be elevated? Another classic sign to distinguish if a patient has Cushing's syndrome from Cushing's disease is that in Cushing's disease, they will have the liver spotted skin pigmentation changes and they'll be hairy, but that's not going to be a present in Cushing's syndrome. Okay, so in Cushing's disease, they have the brownish spots on their lips, fingers, your palm of hands and things like that, and they're hairy, and that you're not going to see these signs in Cushing's syndrome.
No. So in Cushing's syndrome, your cortisol levels will be elevated because you either have a tumor on your adrenal glands that's causing an increase of cortisol being produced, or you could be taking medications that's causing an increase in your cortisol levels. Your ACTH will be decreased though because your hypothalamus is not secreting ACTH, okay, for it to be made to cortisol here. You have a tumor that's automatically increasing your cortisol levels. So there's a different effect with these levels or results in Cushing's disease. In Cushing's disease, you have an increase in ACTH and cortisol. You have a tumor that's secreting ACTH and that's getting turned into cortisol. They do tests to see if
the doctors obtain different tests to see why your cortisol levels are high. The first thing they ask is the cortisol levels are high? Are they high? And in both Cushing's disease and Cushing's syndrome, it's going to be elevated. But the thing is, uh, which one do you have? So they're going to give you a low dose of cortisol. Okay. Normally, if you have high levels of cortisol circulating in the blood or in the body, your pituitary gland is going to respond to that by turning off the production of cortisol. That is what happens in normal people. And when doctors give this low dose of cortisol, they're expecting for your pituitary gland to respond to it and decreasing the cortisol production. But if you have Cushing's disease or syndrome, your pituitary gland is not responding like that. And this is how they know you have uh, either Cushing's syndrome or the disease. So now it's time to see which one you got. The next thing they do is going to obtain an ACTH test. This is going to help us find out where is it coming from. Is it coming from the pituitary a pituitary tumor or an ectopic tumor somewhere in the lungs or somewhere else in the body, or is it the adrenal gland that's hyperfunctioning, and which is why there's high cortisol levels, because there's a tumor on the adrenal gland itself? Or are you taking too much corticosteroid medications that could be why your cortisol levels are elevated? The ACTH test is going to help us narrow it down to which kind you have. Okay. If ACTH levels are high, this means that it's coming from either the pituitary tumor or ectopic tumor, because the adrenal gland tumors, they shoot out, that tumor is going to shoot out cortisol, not ACTH. It does not need it. So again, they're going to obtain blood to see how elevated, or if you have elevated ACTH levels, and if they're high, this is how they know you have either a pituitary tumor or ectopic tumor somewhere in the body, like in the lungs. It can be anywhere, but most commonly it's the lungs. These tumors are rapidly secreting ACTH. And when I say these tumors, I'm talking about your ectopic tumors, like in the lungs that you'll find. Your pituitary tumor is secreting ACTH. Okay, your adrenal gland tumor is not secreting ACTH. It's directly secreting cortisol. So again, if the doctor draw your blood to test to see how elevated your ACTH levels are, if they're elevated, this is going to let them know that you have either a pituitary tumor or an ectopic tumor, where it can be anywhere in the body, but most commonly it's in the lungs, small cell carcinomas. So after finding out that it's either a pituitary tumor or an ectopic tumor, now it's time to distinguish if it's a pituitary tumor or if it's an ectopic tumor. And the test they do here is a CRH stimulation test. And what this is that they're going to give you CRH. If you give the pituitary gland tumor CRH, it's going to turn it into ACTH. This leads to an increase in your cortisol levels, okay? The tumor is acting like it is the pituitary gland. So when you give the hypothalamus secretes CRH for the pituitary gland to turn it into ACTH. However, the doctor is going to synthetically give you CRH, and this is going to trigger that tumor to respond by increasing ACTH. Therefore, you're going to have an increase in your cortisol. So that pituitary tumor is going to turn that synthetic CRH that the doctor's going to give you, is going to turn it into cortisol or ACTH that leads to cortisol production. Okay. However, if you give CRH to adrenal tumor, okay, like in Cushing's syndrome, that's not going to do nothing, because the adrenal gland itself is constantly pumping out cortisol. All right. But when it comes to giving CRH to see if it's ectopic somewhere in the lungs or anywhere in the body, or a pituitary tumor, the pituitary tumor is going to respond. The ectopic one is not, okay? when I say the pituitary tumor is acting like it's the pituitary gland, what does the pituitary gland do to CRH? It's going to convert it into ACTH. And if you have a tumor that's acting like it's the actual gland, it's going to turn it into CRH2. It's going to turn it into ACTH2. And that is how the doctor knows that it is a pituitary tumor that's the reason for your high cortisol levels. Another test that they are going to perform or can perform to further verify if you have a pituitary tumor is that they'll give a high dose of dexamethasone, which is a steroid. This high dose is supposed to respond. Your pituitary gland normally it responds to high cortisol levels by decreasing the amount of cortisol that's being produced. Okay, however, that's not happening right now because you got high cortisol with this tumor being on your pituitary gland. So if the doctor gives you a high dose of cortisol or dexamethasone, which is a steroid, this is cortisol, it is going to trigger that pituitary tumor because it's acting like it's the real gland. It's enough to trigger that pituitary tumor to stop making cortisol and or ACTH, which turn into cortisol. And this is how they know, okay, yeah, this one is a pituitary tumor that's causing Cushing's disease for this patient. If the tumor is ectopic, if it's given CRH, there will be no response to it because it doesn't need CRH to make ACTH. It's not acting like it's the pituitary gland, like the pituitary tumor, okay? Ectopic, it is somewhere far away from the pituitary gland. It's in the lung somewhere. It's somewhere else, okay? And if the doctor give you CRH here to see if you have ectopic or the pituitary tumor one, they'll know you have ectopic if there's no response to the CRH. Because if the pituitary tumor gets it, it's going to respond by turning into ACTH. But here, if they give it, that level is going to stay the same. That's how they know that, okay, this is ectopic because ain't nothing changing. But if something changes, that's how they know it's pituitary. So back with the ectopic, they obtain the ACTH test. They see that your levels are high. Okay, they come in. They say, well, we need to see if it's ectopic or pituitary. So what they do, they give CRH. CRH is to stimulate a tumor into making it create more ACTH. If it creates more CRH, this lets you know that it's a pituitary tumor. But if there is no creation of ACTH from the CRH, then this is how you know it's ectopic somewhere because it's not acting like it's the pituitary gland. So after they find out that it's either an ectopic or it's a pituitary tumor gland, they're going to do x-ray on it, and then they're going to talk about surgery to remove it. Okay. Now let's go back to since we already talked about if it's coming from the pituitary or ectopic tumor source, okay? Let's talk about what happens if it's the adrenal glands. What they do, they obtain the ACTH. Well, for this blood test to confirm levels, it's going to be decreased because ACTH is not needed with the adrenal gland tumors because the adrenal gland tumors themselves are producing cortisol and directly putting it into the blood. Okay, if they give CRH to this, won't nothing happen because it don't need CRH to make cortisol. Okay, if they give a high dose of dexamethasone, ain't nothing gonna happen here because it's a tumor that's secreting nothing but cortisol on its own anyway. Okay, so now, so if ACTH levels are low, this means that cortisol is being pumped out by a tumor or the patient's taking too much steroid medications. This is how they know if you have Cushing's syndrome. Here, they're going to obtain an X-ray and they're going to talk to you about the removal of that adrenal gland tumor. Nurses, understand you don't really have to know what the provider undergoes to a degree to diagnose a patient with Cushing's syndrome. I just found it very intriguing. It was like a Sudoku puzzle in learning how they diagnose a patient. You don't ridicule yourself if you didn't get it the first try. Okay, it just, I'm learning from a doctor, and I be trying to tell y'all that I have to know when to cut it off from doctor to RN. But don't lose yourself in trying to figure this out. Just know that the goal here in Cushing's syndrome or disease is that they're trying to find the tumor and remove it to help you. Okay? Thank y'all for staying this long for the lecture. I hope the songs help relax you. Thank y'all. See y'all later or talk to you later.